Hi, my name is Martin. I'm the CEO and co-founder of Vilintra, and today we have a couple of rapid-fire questions and answers. We're digitalizing the clinical trials. Right now, clinical trials are becoming more and more complex. The regulation is getting stricter and stricter. We're trying to address those pain points by bringing it all together into one same digital solution, thus streamlining the process, making it more efficient, and making the life of people actually conducting the studies easier. Vilintra is all-in-one trial management platform. It digitalizes and automates the clinical trial process. In recent years, there have been quite a few advancements in AI technology, and for us this was really helpful because we're in the generative module, our innovative part of our solution. We're also utilizing AI. And at the same time, regulation in the last couple of years has gotten that strict that all-in-one platform is becoming basically the only possible solution to all the regulations that we have to adhere to right now. Up to this point, pharma sector was mostly dominated by large IT companies, and all of their solutions were designed top-down. So they made a general solution, then customized it for the needs of a specific customer. Whereas us, we knew exactly what is needed by generic drug companies, and our solution was designed bottom-up, so it can be easily implemented without any additional customization. And it was basically made by the people conducting the studies for the people conducting the studies, so their life is becoming much easier by using our solution. That's a good one. For decision making and analysis, when you have enough time and enough resources, of course, AI is the way to go. But a lot of times when we have to make ad hoc business decisions, I think human instinct is still the way to go. Tricky. For us as a startup team, we have a combination of both, so my answer is also both. You need on one side young people that are going to go head first through the wall, and on the other side you need experienced team members who have done it before, who know exactly when to pull the brake and make a decision before you make the next step in your startup journey. In my view, there have been very few companies who successfully set the trend. So for us, it's not about setting a trend. For us, it's more of improving the already existing markets. Specifically for us, it's really important to set a new benchmark in how clinical trials should be managed and how they should be automated. And that's it. Thank you so much.